You want to know what real life nursing is all about? This is the Daily Round Show by NRSNG.com.
Hey guys, Susan with NRSNG and the Daily Show here. I wanted to talk today about making a connection with your patient. I think that's one of the most important things that you need to do as a nurse. Got my patient here. This is Belly. Belle suffers from abdominal pain when she doesn't get enough belly rubbings. And if I were to come into the room right now and talk to Belle, I would say, Belle, what brings you into the ER today? She would tell me horrible belly pains, and I would say, oh, that's really terrible. But what I would tell her most importantly to make the connection is I would tell her, I'm so glad you're here today, Belle. I want to find out what's wrong with you and I will take good care of you. Most patients really like it when you make little connections like that, when you talk about how you're going to take care of them. You make key points to make eye contact and say things like, I'm glad you're here. It's always really important when you have a patient that you also make sure to acknowledge their family members as well. Ask them if they need anything. Can I get you anything to drink? A blanket? Small little gestures like that can really help out with the patient feeling like they're cared for and that their family members are welcome. And a lot of patients want to hear that the people they love and care for are welcome and can be there for you. Make sure that every time you go into your patient's room that you update them on what it is that's going on, even if it's just that you're taking a set of vitals. Let them know, I'm taking your vitals, I'm going to be updating your chart. We are still waiting on results, or we are waiting on, a certain doctor to come see you. Or perhaps I'm going to reassess you in an hour or maybe even like 15 minutes to see how this medication that I'm giving you works. If you make sure to reiterate what it is that your plan is with them, they always feel in the loop, and that's a really great way to make a connection with your patient. First, learning how to walk into a patient's room and you don't know what to say, but I usually walk in and I introduce myself. Hi, my name is Susan. I'm going to be your nurse today, or I'm going to be your student nurse if you're in clinicals. And I ask them how they're feeling, what brought them in, what's going on today. This is Belle, she's my patient. Come here, Belle. Belle's here with abdominal pain, and she needs more belly rubbings, doesn't she? When I talk to Belle, I usually say, Belle, on a scale of 1 to 10, 10 being the worst, how bad is your pain? And she'll be like, woof, it's a 10 when you don't pet my belly. And then I tell Belle, I'm really sorry to hear that. If there's an order, I'll be like, I'd love to take care of that with this, pain medication. And also implement things like distractions. Belle would be very distracted by perhaps a treat, which we can get her. Other things that might distract Belle are like turning on the television, or, you see it? No, you're just gonna have your treat. Turning on the television, getting her pillows, blankets, things like that. One of the things that I always do when I am in a patient's room is I make sure, when I'm making a connection, that I let them know that I'm really thankful that they're here and that I'm thankful that I get to take care of them. I'm glad that I am able to help them in their life, and I'm wanting to fix whatever problem it is they have. So if she has belly pain, I want to figure out what's wrong with her belly pain, and I want to make the pain go away. So usually I will say, Belle, I'm really sorry to hear that your stomach hurts. I'm glad that you're here and I'm going to take care of you today. Another thing that's really important is making sure that you make a connection with the family members, because it's really important to them that they have the love and support around them, and that those family members are happy as well. Your family members are going to feel happy if patients, well taken care of, all of their needs. Offer things even as silly as a blanket or a pillow can really mean a lot to a patient and to their family members. Can I get you something to drink? Can I get you a blanket? Can I try and find you a more comfortable chair if you think that they're going to be in the hospital for a long stay, perhaps even staying overnight? So it's really important to make sure that you just have a good connection with your patient, that you go in, you look at them, you inform them of the plan of care and the things that you would like to do for them. Every time I go into my patient's room, I update them on their plan of care. I think that helps with a connection as well. You can just say, hey, I'm here to give you this medication. I'm going to reassess you in about 15 minutes and see how it's working. Our current plan is we're waiting for imaging or results to lab tests, or even possibly for a doctor to come see them. And keeping them updated makes them feel secure in what it is that's going on as well. So I hope this helps you guys figure out what to do to make a connection with your patient. I will see you all tomorrow.